Welcome, everyone, to the 2024 Graduate Diversity Admissions Fair with the Berkeley School of Public Health. We are so excited to have you here today. A gentle reminder that this session is being recorded, so please be mindful of your microphones. If you'd like to stay off camera, please feel free to do so. We will have an opportunity for questions at the end of the presentation. Additionally, I do have someone very special here with me today, Stephanie Nguyen, who is part of our online admissions team, and she will be with taking care of the Q&A chat. So if you have any questions, please go ahead and add it to the Q&A feature within Zoom, and she will do her best to answer any questions that come through there. We will also, like I mentioned, have an opportunity at the end of this presentation to get to any questions that may have not gone answered in that chat, or if you have any questions that may come up throughout the presentation. But we are so excited to have you here today. So let's go ahead and dive right in. All right, just a few quick introductions. My name is Lauren Albandian. I use the she, her pronouns, and I have the amazing honor of serving as the admissions and recruitment coordinator here for the Berkeley School of Public Health. I wanted to take some time to introduce the rest of my team. Unfortunately, they're not able to join us here today, but they are crucial to our work and are serving you, so I want to be sure to introduce them. Derek Bynum, he utilizes the he, him pronouns, and he serves as the director of our in-resident admissions and recruitment. And Yesenia Mercado, who utilizes the she, her, ella pronouns, and she serves as our funding and admissions manager. So a quick overview of the topics that we'll be discussing today. We're going to do an introduction to Berkeley Public Health, understanding a little bit more about who we are and what makes us so special, going through our admissions process, understanding cost of attendance and what it means to fund your education, and of course, going over student resources and opportunities available here at Berkeley and on within the School of Public Health specifically. And last but not least, we will have an opportunity, as I mentioned, for any questions. All right, so let's dive in. First and foremost, let's talk about what public health is, right? Oftentimes, people think of public health and medicine being the same thing, and they have their distinctions. Public health is very much population focused and is very concentrated on prevention, whereas medicine is very much focused on the individual and looking towards treatment. Public health also emphasizes understanding how environment, human behavior, lifestyle all influence our health as a population, but also as individuals. And there's a very much social science focus in public health compared to medicine, which is more focused on the clinical sciences. So why go to graduate school? Why go to graduate school in public health, right? So graduate school gives you a great opportunity to advance your training in the field, gain a new set of skills, sharpen the skills that you already have. You work with like-minded people. And here at the School of Public Health specifically, we offer great opportunities to go out there and apply these skills that you've learned through a program called our practicum. So this is a requirement of our Masters of Public Health students, and it gives you a unique opportunity to get out into the field, apply some of the skills that you've learned, and really come back in your second year as a Masters of Public Health student and apply those skills that you've learned. We also offer leadership development and, of course, networking opportunities. Graduate school is a great place to network. Learn more about your peers, learn about the faculty that you work with, the communities that you engage with. So it's a vibrant opportunity to just grow the possibilities and grow your opportunities. So Berkeley Public Health stands on four pillars, our values, right? What we stand for. And we believe that health is a right and that it's a basic human right to a healthy life, and everyone should have access to it. We believe that there is strength through diversity, right? So this could be in your education, the research that you conduct, the way that you service your communities, right? Thinking forward, we're all about being innovative, finding ways to, take the challenges that are experienced in the world right now and find innovative ways to solve those challenges and thinking about our impact, right? So finding ways to focus our education, our research, the services that we do in our communities to really transform the what it means to live a healthy life and find innovative ways for the communities that we serve. Our mission is to improve population health, especially for the most vulnerable. And we have a vision here that we want health equity and social justice for all. So I wanted to kind of give you all some metrics to understand a little bit about Berkeley Public Health by the numbers. So 47.5% of our graduate students here self-identify as being first generation. So the first ones in their family to pursue a graduate degree. 15% of our graduate students are international students, and 28% of our students self-identify as underrepresented. As you can see, we have a lot of diversity here at in our School of Public Health. And that, like we said, there's strength through diversity, right? And we value that so much. That we have 800 students total within our graduate programs. This is across master's degrees, doctorate degrees, and both academic and professional in regards to both of those degree options. And in terms of our gender breakdown, so we do have a little over 72% of our students are female identifying, a little over 24% of our students are male identifying, and a little under 3% of our students are non-binary identifying, with a few who have declined to state theirs. But this gives you a great scope and understanding a little bit about our student body by the numbers here. So why Berkeley Public Health? What makes our public health program so special, right? So as a university, we stand on a long history of student activism and finding ways to be involved, challenge the status quo, right? And we continue that legacy in the students that we have here on our campus to this day. We value, as I said, diversity, respect, equity, action, and multiculturalism. And we have a very unique program or office rather within our School of Public Health called our Dream Office, where they find ways to allow for that community to be built. We are not tied to a medical school. So there are some public health programs that are tied directly to a medical school. Our program is not. We are the Berkeley School of Public Health. We do have collaboration with UCSF Medical, which is right across the bridge from us here in the Bay Area, but we are not directly tied to any medical school. We offer great hands-on experience both in the classroom and out of the classroom and community engagement efforts. And we are connected to one of the best areas, in my opinion, in the world, the Bay Area, right? We have such a diverse community around us. We are in the heart of the East Bay with Oakland just south of us. We have the California Department of Public Health located not too far away from us. Alameda County Department of Public Health, San Francisco Department of Public Health. So there are so many ways for you to stay connected, not only on the Berkeley campus, but in the surrounding areas as well. We offer career services through our RISE office, which I'll have an opportunity to share a little bit more later on in my presentation. We offer amazing student groups to get involved with. And of course, we have an interdisciplinary partnership. So we are very much about understanding not only how public health can affect the world and change the world to make it a better place, but in turn, how is the world really affecting our public health efforts as well? So now that you're like, oh my gosh, Lori, I am so excited to go to Berkeley. Which degree should I do? What are the options that you have available? Well, here they are. So our most popular program is our 2-year Masters of Public Health program. As you can see here on your screen, we have a variety of different concentrations available. Anything from epidemiology and biostatistics to health and social behavior, food, nutrition and population health, health policy and management, environmental health sciences, global health, infectious diseases. So many different options for you to explore for your Masters of Public Health. We also offer an 11-month Master's of Public Health in a few of the concentrations that I mentioned earlier. This program is designed for individuals who already hold some type of advanced level degree, whether that's a doctorate degree or another master's degree, and want to come back and add another level to their education through an 11-month accelerated program. For our students who may be current UC Berkeley undergrad students or have recently graduated with a BA in public health from UC Berkeley, they qualify or you qualify for the 4+1 program. So this is a unique program here at UC Berkeley for our public health bachelor students. Through our program where they can do an additional year to earn a master's degree in one of the three concentrations that you see here. So epidemiology, maternal child adolescent health, and food nutrition and population health. We also offer a unique program called our Joint Medical Program or the JMP program. This is an MSMD partnership that we have with UCSF Medical across the bridge. And this allows you to earn both your medical degree and your Master's of Science at the same time while you're pursuing both educational opportunities. We also offer both an academic PhD, so what's traditionally known as a doctorate of philosophy or PhD degree, and we also offer a professional doctorate degree called our Doctorate of Public Health. Our PhD offers 5 different concentrations: biostatistics, epidemiology, environmental health sciences, infectious diseases and immunity, and health policy. Our doctorate of public health is an interdisciplinary degree. And you may be asking, what's the difference between an academic degree and a professional degree? An academic degree is very much focused, is very research dense. So most individuals tend to stay in academia while they're pursuing a PhD degree and after completing a PhD degree. Individuals who pursue a professional degree, in this case, a doctorate of public health degree, is very much centered around leadership and understanding how they can apply their degree in very hands-on, community-based research and organization. So individuals who earn a professional doctorate degree in public health usually end up going and working for nonprofit organizations in the public or private sector in some realm outside of academia. We also offer a unique program called our concurrent MPH degree program, and this gives you an opportunity to earn 2 master's degrees in 3 years. Usually, a master's degree takes about 2 years. In this unique space, you can earn 2 master's degrees in 3 years. So this could be a partnership with our Masters of Public Policy, Journalism, City Planning, Social Welfare, or a Master's of Business Administration. So you will earn a degree in that partnership school, and you'll also earn an MPH here at Berkeley Public Health. We also offer Masters of Arts and Masters of Science degrees in biostatistics, epidemiology, environmental health sciences, and global health and environment. Although we are covering topics today around our residential program, I do want to highlight our online Masters of Public Health program. Our online Masters of Public Health program is a wonderful opportunity for individuals where an online degree may be an option that is more applicable to their lifestyle and what they're looking for. So I encourage you, if you do have questions about the online Masters of Public Health, reach out to our online MPH team, and I know that they would be more than willing to assist you with any questions that you have about that program. So the big question is, oh my gosh, Laura, you gave me all these options, but which concentration is going to be the best one for me and what I'm looking for? Well, here are some tips to figure out which one may be the best option. I encourage you to visit our website and the program-specific pages for the different concentrations that we offer. On these pages, there is a handbook which breaks down the entire program, what their mission is in that program, the classes that you will potentially take as a student here, learn about our faculty. It just gives you a better, deeper dive glimpse into what it means to be a student in that specific concentration. I also encourage you utilize the admissions requirements to understand what each program is looking for in a competitive applicant, right? So whether that's work experience, and just navigating what it means to be a competitive applicant in that program or for that program specifically, rather. And we have an opportunity here through our School of Public Health for you to talk to a current student, a current master's student or a current PhD student, and learn more about what it means to be a student in that program. That is available through our Dream Office, and you can schedule a meeting with them by reaching out to that email, sphdiversity@berkeley.edu. I will have this contact information at the end of the presentation as well for you, but this is a great opportunity that I encourage you to utilize. So you're like, Lori, I got what concentration I want to do. I am ready to apply. How do I do it? Let's dive right in. So first and foremost, I encourage you to read through these residential admissions requirements. These are the baseline requirements for a student to be eligible to apply for our programs here. So you must hold a bachelor's degree or a recognized equivalent from an accredited institution, a satisfactory scholastic average GPA of a 3.0 on a 4.0 scale. And we do focus primarily on the last 2 years of your undergrad education and any post-baccalaureate work that you may have completed. So let's say you graduated from your undergrad program, you decided to take a class through Berkeley Extension or San Diego Extension, and you scored well in that class. Those transcripts will all be sent to us, and they'll be used to calculate what is called an advanced GPA. Okay. We also encourage you to look at the individual program requirements to see if they have any specific prerequisites for that program. So you want to be sure that your undergraduate training is preparing you for the graduate coursework that you may have chosen in the area of study that you're looking for. For our international students, a passing TOEFL or IELTS test score may be required. It is going to be important to recognize whether or not you're going to need a TOEFL or IELTS test score as early as possible, just so you can prepare to take that exam and request for those scores to be sent to us in time before the application deadline. So if you have questions whether or not you're required to take the TOEFL or IELTS test, you're of course, more than welcome to reach out to us, and we'll be more than willing to help you figure out whether or not you'll be required to do so. And of course, last but not least, submission of all required materials. So let's go ahead and look into what are the required materials. So our applicants with a US or English Canadian bachelor's degree, this is the checklist that you want to be sure to have, written down. This is available on our website. And some of our programs require a SOFA's application. So this is applicable for our Masters of Public Health programs. This is applicable for our Doctorate of Public Health programs. So you want to be sure to look under the program requirements to see whether or not the program of your interest requires a SOFA's application. All programs require to submit a UC Berkeley graduate application. So whether it's a PhD program, an MPH program, all applicants are required to submit a UC Berkeley graduate application. For our SOFA's applicants, it is an abbreviated version of that UC Berkeley grad app, just so you're not required to duplicate all your materials in the Berkeley graduate application. And again, this is a process that we can talk through a little bit more here in just a minute, just to give you an idea of what that means to apply for each different program. A CV or a resume is also required. Statement of purpose, personal history statement, 3 letters of recommendation, transcripts from each and every institution that you have attended. So if you took classes at a community college, if you took classes through Berkeley Extension, if you studied abroad, all transcripts should be sent to UC Berkeley when you are applying to our program. Official GRE test scores, if applicable. So there are only a few programs that require GRE test scores. For the majority of our programs, it is optional to submit a GRE test score. So you want to be sure, like I said, to review your program requirements to see whether or not you're required, or if it may be something that you would be interested in pursuing and applying with your application. and a writing sample. A writing sample is required by a few of our programs as well. And so you want to, like I mentioned, it's super important to review those program requirements just to be sure that you have everything ready to go for the program of interest. For applicants with a non-US or non-English Canadian bachelor's degree, you have the same checklist with a few added check boxes, including WES evaluation for international transcripts, which should be sent to SOFAs. Additionally, any official TOEFL or IELTS test scores if applicable. So here is a typical timeline of fall admissions cycle. So as you can see here, our SOFA's application opens up in mid-August. So our SOFA's application is currently open for students interested in our MPH or Doctorate of Public Health programs. So you want to be sure to, if you haven't done so yet, start that application. If you're looking to apply next year, then this can be something that you can mark on your calendar to be aware of next August. The SOFA's application is the centralized application system for public health programs in schools. So majority of public health programs around the world utilize the SOFA's application system. For our UC Berkeley graduate application, that typically opens sometime in mid-September. So it is open now for the Berkeley graduate application. As I mentioned, SOFA's applicants are required to also submit a UC Berkeley graduate application. The process in which you receive the application or you submit that application looks a little bit different for our SOFA's applicants, just because you will submit your SOFA's application first. Once you submit your SOFA's application, then an email will be sent to you, prompting you to create your login for your UC Berkeley graduate application with a unique PIN that's unique just to you. And you utilize that to create your login, pay the application fee, and then you're done with that for the Berkeley graduate application for our SOFA's applicants. Our non-SOFA's applicants, you will go through and fill out all your application materials and submit the fee waiver and submit your application that way. For our admissions deadline, so our admissions deadline is December 2nd. So if you're interested in starting in the fall of 2025, our application is now open. You still have plenty of time to get your application in. For best chance of gaining admissions and financial aid, it is going to be important to submit your application by this December 2nd deadline by 8:59 p.m. We do have a second application deadline of March 3rd. However, that's only for a few of our programs. Majority of our programs, December 2nd is the final deadline. The only programs that offer a second application deadline are our interdisciplinary 11-month MPH program and our food nutrition and population health 11-month and 2-year MPH program. You went through the process, you did your application. When do you find out? So application decisions are released by late February. So be patient with us as we go through our admissions process, we review your application. You will receive notification by late February. So here are two things that I want to cover that students often have questions about. What's the difference between a statement of purpose and my personal history statement? Your statement of purpose in one sentence is your why. Why do you want to come to UC Berkeley? Why in the specific degree concentration that do you want to pursue that? Why now? Why do you feel now is the right time for you to go back to school or continue school and earn this degree that you want to earn? And of course, through this statement of purpose, you want to demonstrate an alignment with the program of your choice, right? Whether that's a master's degree, a doctorate degree, you really want to do your research and understand the program to which you're applying and why it's so important to you and what it means to you to earn this degree. You want to talk about any public health experience that you may have and how it relates to your future goals, highlight your skills, but also don't be afraid to highlight any gaps in your knowledge. We understand you're coming to school, you're continuing your education, you're going to learn so much while you're here. And this gives you an opportunity to share, this is the reason why I want to come to Berkeley. This is the reason why I want to pursue this degree, and just share some specific goals of why this program is the right one for you. Personal history statement, this is the who. Who is the program applying? Who is the person applying to this program, right? We want it to be focused all on you. Tell your story. Be authentic in your story, right? Demonstrate, what it means to be you. And nobody else can tell that story besides you. It's going to be important, if you've experienced any barriers or challenges, obstacles, talk about that if you feel inclined to do so. It's okay to be vulnerable. Life happens, experiences happen. It has all shaped you and made you into the person that you are today. This should not be the same as your statement of purpose. Your personal history statement should lay a foundation for the admissions committee to understand who you are. Your statement of purpose allows them to understand why you want to come to Berkeley and why you want to pursue this degree. So, cost of attendance and funding your education, depending on whether you pursue an academic degree or a professional graduate degree, the cost breakdown is going to look a little bit different. For individuals pursuing a graduate degree that is an academic degree, so a PhD, an MA, or an MS program, it is going to be around $11,395 for our resident students per semester. So this cost breakdown is per semester. I just want you all to be aware of that. And these costs are estimated to change, are expected to change from year to year. So just be aware of that this is for this academic year. For our non-residential students interested in an academic degree program, it's about $18,946 per semester. For those who are interested in our professional degree programs, so our MPH programs or our DRPH programs, it's about $16,661 for our residents. And then for our non-residents, about $22,783. Do not worry, there are plenty of ways to fund your education while you are here as a student. For those of you who are able to, filling out a FAFSA or a DREAM Act to be eligible potentially for federal loans, just to have as a backup in case it is needed. Merit and need-based fellowships are available through our program here. The way that our funding application works is we do not have a separate funding application. Our funding application is embedded into your admissions application. So there will be a section talking all about funding. Fill that section out to the best of your ability. Take your time, answer them as thoroughly as you possibly can, and that will be utilized to help demonstrate which fellowships you may be considered for after your admissions decision has been made. Training grants are also available on campus employment, such as becoming a reader, a TA, work study opportunities, if that is available to you, off-campus jobs and internships. We're located right here near downtown Berkeley, so there are plenty of opportunities to find off-campus employment opportunities and external funding. Don't forget about external funding. It is so important. Don't discount the $500 scholarship, the $1,000 scholarship. Those all add up and make a big difference. Berkeley Public Health student resources and opportunities. So these are just some of the graduate student resources available to you here as a Berkeley student. We have resources for our parents, such as the ECEP, which is an Emergency Child Parent Caregiver Grant. We have our SEP program, which is to help with any tech hardware systems. We have a D-Lab, which is to help with research development if you need additional support in that area. Our Graduate Wellness Center, which is focused on graduate wellness and mental health services. Our Basic Needs Center, which has a food pantry. They help with signing up for CalFresh, emergency housing loans, and resources for our international students as well. And Easy Pass. So you do get free transportation as a student here at Berkeley for local bus transits and as well as the campus transit that's available to help you get through campus. So this is one of our resources that we have available here through our Berkeley School of Public Health specifically. And I spoke of them just a little bit earlier today, but I want to highlight our Dream Office. Our Dream Office offers services for students just like you, our prospective students who are looking into our programs. The program that I spoke of earlier, where you can connect with a current student, those are called our prospective student ambassadors or PSAs. PSAs are a wonderful group of students who are here to help you understand what it means to be a Berkeley student. Answer any questions that you may have, whether it's what are some employment opportunities that you've pursued, or what are ways that you do research with faculty. They are there to assist you and answer any questions that you may have for our current students. So once you fill out the application, get it all in, and you become a Berkeley Public Health student, these are the services available to you. We have our summer seminar, which is a 4-day intensive that happens about a week before classes formally start in the fall of your first year here at Berkeley. And this gives you an opportunity to be introduced to the Berkeley campus, to learn about campus resources. You do a workshop with our D Lab on campus, and it just helps you get back into the mindset or get into the mindset of being a graduate student here at Berkeley. We offer a food pantry and community closet. So this is offered twice a semester, where it's completely free for our Berkeley Public Health students to come by, grab anything they like, no questions asked, of non-perishables, fresh fruits and vegetables, and a community closet with gently used clothes and shoes. We also have a suite here called 2220 within our Berkeley Public Health building. And this is an opportunity to just have snacks and coffee always available for our students to just come by, take a little rest, reset before class or after class. And we also offer EPI tutoring services and biostatistics tutoring services. Our RISE office is our career and leadership office within the Berkeley School of Public Health, and they're really here to help you with leadership development, understanding your career in public health. They offer things like resume workshops. They do formal LinkedIn headshots for you. They offer one-on-one advising sessions to discuss, what are your next steps in your career. And here are some ways that you can get involved as a student within our Berkeley School of Public Health. So many student groups are available, and here are just 5 of those student groups. We have our Alianza Latina for Public Health Action, Asian and Pacific Islander Women's Circle, Black Advocates for Equity and Health, Queering Public Health, and Student Collaborative for Impact Leadership. Student government. We have a student government here specifically for our Berkeley School of Public Health, which has it's all comprised of our student representatives. We have different committees that you can get involved with, such as Diversity, Equity, and Inclusion Committee. And we have an events committee, which hosts a Berkeley Public Health prom every year. Yes, you heard that correctly, a Berkeley Public Health prom. So it's just a fun way for you to get together with your friends at a restaurant or a location off campus. There's music, there's food, there's dancing, and it's such a fun night for our Berkeley Public Health students. One of the committees that you can get involved with is also our Wellness and Sustainability Committee. We do have a community garden here at the Berkeley School of Public Health, and it just gives you an opportunity to go outside, be engaged, be under the sun, and just get in and be involved with your community in a wonderful way. We also value, being sustainable and finding ways to be more ergonomic for individuals who may need it, and just finding ways for mobility. And last but not least, you've gone through our application process. You've gone through our program. You've moved that tassel over on your cap and you've walked that stage. Where are you going after graduating from Berkeley? Where do our alumni go? So once you graduate from Berkeley Public Health, as you can see, our students go in all kinds of different directions. Some students continue their education with a PhD or go to medical school. Some dive right into the workforce, whether that's working for the California Department of Public Health, CDC, Kaiser Permanente, Berkeley Free Clinic, Sutter Health. Some students take a break and may travel after they graduate from Berkeley and then come back to an employment opportunity. It all varies from student to student, but here are just some of the amazing places that our students go after graduating from Berkeley. I want to thank you all so much for joining us today. It has been so much fun to share all this information with you all. There's about 20 minutes or so left for Q&A. However, I do want to take this opportunity to just share this important contact information with you all. If you have any questions about the application process, international student requirements such as TOEFL, understanding just a little bit more, setting up an advising appointment, go ahead and reach out to our sphadmin@berkeley.edu email. For any funding questions, so understanding a little bit more about funding, if you have any questions about the funding questions on your application, go ahead and reach out to sphaward@berkeley.edu. And last but certainly not least, if you would like to connect with a current prospective student ambassador or just learn more about our dream office, feel free to reach out to sphdiversity@berkeley.edu. And of course, follow us on Instagram, LinkedIn, Facebook, and Twitter, or better known as X now. I'm going to go ahead and stop the recording for the Q&A portion, and then we can dive right into any questions that any students may have.